The next dissection is looking at the arteries and veins posterior to the diaphragm. We have our diaphragm here with the thoracic cavity anterior, and if we open up the abdominal cavity, we can start to search for the arteries and veins that you need to know. We reflect the liver, and at the point of the, let's do this again. The next dissection are the arteries and veins posterior to the diaphragm. Here's the diaphragm, and if we open this up, there's a lot going on here. So the best place to start is to go back to where we were in the last dissection at that thoracic aorta. The thoracic aorta continues into the body cavity, and if we cut through the diaphragm at the level of that thoracic aorta, we can start to expose the abdominal aorta. It's still the same structure, it's just located within the abdomen. Using that as a guide, you can start to remove connective tissue. Almost immediately upon passing through the diaphragm, you'll get your first artery, the celiac artery. Be careful as you do these dissections because there are some small arteries coming off of the celiac that you need to know. Carefully clear these away, following the guidelines in your textbook to expose those structures. Depending on how well injected your cat is, these may be easy or difficult to see. It'll just take some work to clear them away. Again, you can use your forceps to trace what you need to view, and any connective tissue that is in your way, you can remove. As you clear away connective tissue and fascia, these three arteries should become clearer. This one you can only see for about 1 centimeter, as your textbook explicitly states. Then you have this artery here. And you can continue following these as they move up to the stomach and the spleen. I've kind of broken that one, so just remember where it was. This one has been broken, but you can see the connection. Try to maintain that shape. Moving back down and following that abdominal aorta, we're going to continue clearing away until we get to the next stop. Which is the anterior mesenteric artery. You can follow it as it moves into the mesentery of the small intestine. That's a good place to use as a guideline and look for the posterior mesenteric artery, which is going into the colon. So now you have your anterior mesenteric artery and your posterior mesenteric artery and a general line of where you need to focus your dissection on. I'm going to cut through the peritoneal layer to expose the kidney. Remember, there's the kidney and the ureters. And notice this very delicate vessel, artery. That's going to be the ovarian artery. In females, the spermatic in males will go in a different direction, but should be seen at about the same level. Again, depending on quality of injection, some of these may be clearer to see than others. It looks like there's been a burst in this kidney. The anterior portion of the kidney, this looks like fat. This is actually the adrenal gland. And any arteries and veins going into that region are the adrenal arteries and veins. You have your renal vein, very large and obvious, dorsal to that abdominal aorta. We can continue following the abdominal aorta using our guides that we've established earlier. There's the ovarian vein, possibly. There's that aorta. There's your renal artery going to the kidney. Just continue to move posteriorly in the body until your dissection looks like the textbook. As you start to remove connective tissue layers, again, you'll start to see with some clarity things like the deep circumflex iliac artery. There's usually a vein paired with this. It doesn't seem to be present. External iliacs, internal iliacs, and then the deepest portion here is difficult to see, is the sacral artery and vein. The sacral artery and vein is going to pass through. Once it leaves the body cavity, it'll be the caudal artery and vein as well.